Hey everybody, it's Ray here. I'm just doing another update on how things are going with my transition because I haven't done one in ages. Just a few days ago I passed my 2 years on testosterone. Everything's going really well. At the moment I get 1 shot of Reandron every 3 months. That's 4 mils. It's an oily injection into my butt. The injection itself doesn't hurt that much, but about 5 minutes after, it starts to really throb a lot, and I walk around looking like I've got a stuck up my ass. And usually I've got to take the train back home, so that's always fun. I'm 1 year, 7 months, and 21 days post-op from chest surgery. It's going really well. I put bio oil on my scars most nights, and if I can be bothered, I use silicone strips. My surgeon did recommend the silicone strips to help heal the scars, but because I'm a little bit hairy on my chest, they don't stick very well, and I'll wake up in the morning if I put them on at night, and I'll have one stuck up here and the other one's down near my belly button because they move around. So I've tried to put them on during the day, but then I'll be walking around and one will just fall out of my shirt. So they work really well, but they're a bit not so practical when you're moving around a lot and stuff. But that's okay. I have almost complete feeling back in my nipples. The only part that I don't have feeling is in the very center of the nipple itself. I have feeling on almost all of my, I think it's pronounced areolas or areola, I don't know, which is like sort of the ring around a little bit of the nipple. It's only on my right hand nipple that there's just some bits that just don't have any feeling. It's taken all the way up until about a year and a few months post-op for all of the feeling to come back. So if anybody's just recently post-op, don't freak out. Weirdly enough, all the feeling slowly comes back. My scars are really good. They're really thin and they're really going a pale colour now. And because I have a bit of a hairy chest, they sort of blend in. My what? Which one is it? Yeah, my left nipple, it sort of sags a little bit. I think that's just the way it is from the surgery. It's not going to get any better. I'm hoping the more I go to the gym and train chest, it will the muscle will build and sort of hopefully pull it back into place. If it doesn't improve maybe in the next year, I'll probably see about getting just a brief corrective surgery, but I'm really not concerned about it. It doesn't bother me at all, and my chest is as flat as ever, so it's nothing. So I'll give you a squiz so you can see, well, that's left, but it looks like right on the video, that this one's really good, but this one sort of hangs, and if I had surgery, I'd probably get it just pulled up a little bit. So as for scarring, the scar itself runs down here, and you can probably only just see it. If I show you on that side, it just runs down there. So that's really, really good, in my opinion. For anybody who's wondering, my surgeon's name is Dr. Vladimir Milovic. He works in Canberra in Australian Capital Territory in Australia. He only does surgery in private practices, so I paid a hefty medical bill. But it's really worth it because not only is he friendly and bloody hilarious, and his team are really great, but as you can see, the scarring results are amazing. And yeah, I think he's really professional. He's done a really good job. At the moment, I'm between doctors, so I can't really recommend a doctor for getting testosterone. Although I did live in Melbourne for about 2 months, and there is a sexual health clinic for anybody who is LGBTQI, and there were some really great doctors there. I could recommend any one of them. Yeah, they're all really friendly, and the receptionists when I went there were both transgender, so really all-inclusive. I can't remember the name of the practice itself. It was in the North Fitzroy area, so with a quick Google search you can find that one. So that's basically everything for me at the moment, transition-wise. I'm at a pretty happy state. I have actually had some family members talking to me about bottom surgery, but in my opinion, the technology for it isn't as good as how I would want it to be if I was going to think about getting surgery. In my opinion, maybe within the next 10 years there'll be some more breakthroughs and the results will be a lot better. Not to mention I'll probably need to save up like upward of 50 grand to pay for it. so it's just not an option at the moment. However, I do want to get it one day. So yeah, that is me for now, and now I'm looking at this video, I'm thinking I might grow my facial hair back in. Had a bit of like a chin strap going on, it was looking good. Now that I shaved it off, I'm looking like I'm 12, so maybe next video I'll give you an update on how that's going. But yeah, that's everything at the moment. If anybody has any questions, you can get me on Instagram. My Instagram name is ray_FTM, or you can comment on this video or send me an inbox on either of those things. Have a good one.